Regarding the blood supply of the thoracic region. So first, I'm going to start about the artery blood supply. As I mentioned it before, so from the left ventricle, the ascending aorta is arising, and at the level of the T3 approximately, the ascending aorta is turning to the posterior side and turning to the left side, and it's forming the arch of aorta that I said about the branches of the arch of aorta. Then at the level of the T3 approximately, the aorta is starting going downward and it passing through the thoracic region as the thoracic aorta. Then is piercing the diaphragm, which is, as a matter of fact, is the border between the thoracic cavity and abdominal cavity at the level of the T12. So it will be piercing the diaphragm at this level, which is called the aortic hiatus. So it's entering to the abdominal cavity and it's continue as an abdominal aorta. This level that is piercing the diaphragm is the esophageal hiatus, which is approximately at the level of T10. About the T12, it's the aortic hiatus, which is here. So, as you see, according to the course of the pathway of the aorta, the thoracic aorta is located from the T3 till T12. Then the location is located in the posterior mediastinum. During to its pathway, we mentioned it before that it's making at the mediastinal pleura or mediastinal surface of the left lung. So it's making an impression of the aorta, thoracic aorta, and above the hilus of the aorta, it's making an impression of the arch of aorta. In the beginning, the cranial segment of the aorta, it's more to the left side, and a little bit is an anterior side of the vertebral column. And whenever we are reaching to the caudal segment, the aorta is going to the mid-line in front of the vertebral column. Topographical relationship of the aorta anteriorly and a little bit to the right from the aorta is located the esophagus, which is, we said that it passed through the diaphragm at the esophageal hiatus, approximately at the level of T10. Then in the right side of the aorta, you can see the azygos vein. It's I'm going to discuss. And on the left side of the aorta, here you can see the hemiazygos and accessory hemiazygos vein. In front of the aorta, cranially, is the root of the lung, the left lung, and in caudal portion, in this area in front of the aorta and esophagus, it's the location of the heart, which is located inside the pericardial cavity. Regarding the branches of the aorta, we subdivided to two main branches. So one is visceral branches, which are the branches of the aorta which is supplying the organs, and the other is are parietal branches, which are basically is not supplying the organs. It means that they are supplying the valves and the diaphragm, for example. Regarding the visceral branches of the aorta, the visceral branches of the aorta, they are arising usually from the anterior side of the aorta, and they are not paired. So the first branches, you can see some here, it's the bronchial branches. It's one of the visceral branches of the aorta, which are two or three arteries. Immediately at the level of the bifurcation of the trachea. They are arising from the aorta and continue with the bronchus. They are going to the hilus of the lung, and when the bronchus is divided to the secondary and tertiary and smaller and smaller bronchus, artery also parallel with them, it's giving the branches to the smaller and smaller branches. So this is the bronchial arteries, and this is considered as a nutrition or the nutritive blood supply of the lung. Be careful, we have functional blood supply of the heart, which is the pulmonary trunk and pulmonary artery, that they are going also through the hilus of the lung. So this is the bronchial. Then as you see, there are another smaller branches which are called esophageal branches. Is another visceral branch of the abdominal of the thoracic aorta that is supplying the thoracic course of the esophagus. The cranial part of the esophagus was supplying from the inferior thyroid artery that is supplying the esophagus, and the lower part of the esophagus is supplied by the left gastric artery, the esophageal branch of the left gastric artery. So all of them, they are anastomosing together with each other. Another branches that is not that much seen here, and it's eliminated from this picture. So it's the pericardial branches. Pericardial branches, they are the small arteries arising from the aorta, and as a matter of fact, is the visceral, is supplying the posterior surface of the pericardium of the heart. Also we have the mediastinal branches that also is arising as unpaired branches of the visceral branch of the aorta, which is supplying for example, the mediastinal lymph node, and also the connective tissue that you have it inside the mediastinum. So this is regarding the visceral branches. Then we have the parietal branches. The parietal branches of the aorta, as we said, that they are not supplying the organ, they are supplying the diaphragm, and they are supplying the wall of the thorax. And usually they are arising from the ventrolateral part of the aorta. And the intercostal artery, the posterior intercostal artery, they are arising from the posterior part of the aorta. So the first artery that is as a branch of the parietal branch of the aorta is the superior phrenic artery that is exactly above the diaphragm, before the aortic hiatus at the level of T12. It's coming, here is not seen, it's coming from the aorta, and it's in adult is not that much seen. It's in the neonatal child, it's much more dominant, and it's very nicely, it can be seen above the aortic hiatus. As supplying, and according to its name, it's supplying the superior surface of the diaphragm. And then another parietal branch of the aorta posterior intercostal arteries that you can see here, and they are arising from the dorsal part of the aorta, and because the aorta is located more in the left side, the left posterior intercostal is shorter than the right posterior intercostal artery, which is more longer. Those posterior intercostal artery, they are supplying the intercostal space from the third intercostal space till the 11th intercostal space, and the space below the 12th rib, which is called subcostal space, or as a subcostal artery, it's supplied by this aortic thoracic aorta. Then I'm going to discuss about the branches of the posterior intercostal, which is immediately is divided to the posterior branches and ventral branches. The posterior branches gives the spinal artery that they are supplying the vertebra, the muscles of the back, the skin of the back, and the meninges and the spinal cord. And the ventral branches is continue and it gives the collateral artery or supracostal artery that I'm going to tell you at the level of the costal angle, and also it's giving the lateral cutaneous artery or branches, which is at the level of the 3 till 5 or 2nd till 4th intercostal space. For the female, it gives the lateral mammarian branches that I'm going to discuss. So here it's the cross section at the intercostal space. Here, as we mentioned, here is the aorta, which is located to the left side. Whenever we go to the caudal part, the aorta is going in front of the vertebral column. And at the posterior part and lateral part of the aorta, it gives the parietal branches, which are called the posterior intercostal arteries, that it's supplying the approximately the majority part of the intercostal space. Intercostal space is the space between the two ribs between each other. It's called the intercostal space. And the majority of this space is supplied by the posterior intercostal artery, which is arising from the aorta, and the small part it's also supplied by the branches of the internal thoracic artery, which is giving the anterior intercostal artery here that they are anastomosing with the posterior intercostal artery. So this artery, the aorta, the thoracic aorta, it gives the posterior intercostal artery just for the 3rd, 4th, 5th, and till 11th intercostal space, and the last one, which is going under the 12th ribs, is called subcostal artery. And as we mentioned, because the aorta is located more to the left side, so the right posterior intercostal artery is longer than the left posterior intercostal artery. After the short course, the posterior intercostal artery at the level of the neck of the rib, it's divided to the posterior or dorsal branch and the anterior branch. The posterior or dorsal branches, then it's giving the spinal branches for blood supply of the spinal cord, the meninges and the vertebral column, and also the muscles and the skin of the back region. The anterior branch, it continue and it enter to the place between the muscles. Here, if you pay attention, here from the outside, here is the skin in the thoracic region. If we remove the skin, under the skin is the subcutaneous connective tissue with the fat. And then we have the muscles. In some place you can find the serratus anterior muscle, but the main muscles of the subintercostal space is the external intercostal space, the outermost. Then the middle one is the internal intercostal space and the innermost intercostal space. And as you see, the neurovascular bundle, including the posterior intercostal artery, is between the innermost intercostal muscle and internal intercostal muscle, and passing through the lower portion of the rib. It was a groove which is called costal groove above the costal crest, and in internal surface it was the costal groove. that this neurovascular bundle, which is the vein, artery, and nerve, they are passing through this costal groove. And as you see, and the sequence of these structures is very important. That first is the intercostal vein, second is intercostal artery in the middle, and the most lower part is intercostal nerve. As you see, the intercostal nerve, it's much more prone to be injured because it's unexposed unexposed, and by injury it can be damaged, this nerve. So remember the letter VAN or VAN, which is from the superior to inferior, is the vein, artery, and nerve. The sequence of the arrangement of these vessels and nerve between the innermost intercostal and internal intercostal muscle. So when it's entering to this region, so this anterior part or anterior branch of the posterior intercostal space, at the level of the costal angle, it's giving one branch which is called collateral branch, that is going downward. This collateral branch also has another name which is called supracostal artery, and it's going to the superior surface of the lower rib, and it's continue like this. So here it's the collateral branch of the intercostal vessels. So then when it's going to the lateral part, so then it gives another branch which is called lateral branches of the intercostal artery, the posterior intercostal artery, which is then is divided to the posterior and anterior. So this lateral branch of the intercostal artery, then in anterior side, it is giving for the female at the level of the third till fifth or second till fourth intercostal space, the lateral mammarian branches for the blood supply of the lateral part of the breast. That is sometimes is called external mammarian branches. And finally, this posterior intercostal space at the level of the costochondral junction, it means when the bony part of the rib is fusing with the cartilaginous part of the rib, so it's anastomosing with the anterior intercostal artery, which is the branches of the internal thoracic artery. So this is for the supplying. This lateral branches is for the supplying of the muscles and of course the skin of the lateral posterior and lateral anterior part of the thoracic region, and also the collateral. It's passing together with the veins and nerve above the lower rib, the superior surface of the lower rib. It's coming. So here you can see the collateral, and this collateral artery, it's coming as arising at the level of the costal angle. So this is regarding the posterior intercostal arteries, that they are supplying the majority of the intercostal space. Be careful, the first, second, upper second intercostal space, it means first and second intercostal space, they are supplied, the posterior one, the posterior side, they are supplied by the branches of the subclavian artery, which is called costocervical trunk, which is giving the highest intercostal or intercostalis suprema. It's supplying the first upper two intercostal space, the posterior side, that I'm going to discuss. Regarding the blood supply of the thorax, as I mentioned, the most posterior intercostal space is supplied by the aorta, but the first two intercostal space is supplied by the artery which is arising from the subclavian artery. If you remember, the subclavian artery, which is passing through the scalenic fissure between the anterior and middle scalenic muscle, we divide them to three parts: the intrascalenic part, which is before entering to the scalenic fissure, and the interscalenic part, which is inside the fissure, and extrascalenic part of the subclavian artery. The artery that it's arising immediately here is the vertebral artery that we discussed. Downward, the same level but downward from the intrascalenic part of the subclavian artery, it gives the artery, important artery, which is called internal thoracic artery, that it's going caudally, and it's passing approximately 1 centimeter from the lateral margin of the sternum, behind the cartilaginous part of the ribs. You can find it in the anterior mediastinum, and I'm going to discuss. And the other artery here, which is the branches of the subclavian artery, and it's from the interscalenic part. It means that the branch of the subclavian artery inside the scalenic fissure. And it gives this trunk, which is called costocervical trunk. And this costocervical trunk then further is giving the deep cervical artery, which is here, and is going back deep to the neck region, and it's reaching and it's supplying the deep muscles of the back and the neck region, and also giving the spinal branches for the vertebral column and the spinal cord and meninges. And another branch, which is the branch that we are concerned about, this is called the highest intercostal artery, or intercostalis suprema. The highest intercostal artery or intercostalis suprema, which is a branch of the costocervical trunk from the interscalenic part of the subclavian artery, it's supplying the first and the posterior part of the first and second intercostal space. So as you see, is not supplied by the aorta, but it's supplied by the branches of the subclavian artery. The anterior part of the all intercostal space, there are branches of the internal thoracic artery, which is arising from the subclavian. So this two space, is supplied. The first one and second one is supplied by the highest intercostal or intercostalis suprema, and of course, like other posterior intercostal artery, which are arising from the of the thoracic aorta, it giving the dorsal branches and spinal branches for the blood supply of the spinal cord, meninges, and the posterior surface of the skin and muscles of the back. As I mentioned, another blood supply of the thoracic wall is internal thoracic artery, which is arising from the intrascalenic part of the subclavian artery, opposite to the vertebral artery. It's going down, and it's going to the anterior mediastinum. The location is exactly behind the cartilaginous part of the ribs, with attachment of the sternum, and approximately 1 centimeter from the margin of the sternum, it's arising. During to its course, it gives several branches. The main branches that it's supplying the anterior surface of the pericardium and part of the diaphragm is called pericardiacophrenic artery, that they are supplying and is passing together with the very important nerve with the name of the phrenic nerve. We are going to discuss, and whenever you see on the lateral and anterolateral surface of the heart and pericardium, of course, you can see the phrenic nerve together with the pericardiacophrenic artery and the veins. Usually the veins, there are two. So the pericardiacophrenic artery is branch of the internal thoracic artery, and it's supplying the anterolateral surface of the pericardium of the heart, and it's running together with the phrenic nerve, and it's important, and also it's supplying also the diaphragm. That's why it's called pericardiacophrenic artery. Another branches that of the internal thoracic artery is this artery that or all the arteries that they are called the anterior intercostal artery. Anterior intercostal arteries that I mentioned it before, it's supplying the anterior part of the all intercostal space. As you see, as I mentioned, the posterior surface of the intercostal space, from 3rd till 11, it was supplied by the aorta, and the first upper two, it was supplied by the costocervical trunk branch of the subclavian artery, which gives the highest intercostal artery. So here, the anterior part of the intercostal space is supplied by this artery, which is usually there are two, and they are passing above and below the neighborhood ribs, and they are anastomosing at the level of the costochondral junction with the posterior intercostal artery branches of the aorta. Also, this anterior intercostal artery, it gives the perforating branches or rami perforantes, which are then it's giving the muscular branch for the blood supply of the muscles, and the cutaneous branch for the blood supply of the skin, and also the mammalian branch, which are at the level of the 2nd till 5th intercostal space. They supply the medial part of the breast. So in female, that's why they call it the medial mammalian branches. Then the internal thoracic artery, then it gives two terminal branches. That one of them is the musculophrenic artery, and the other one is the superior epigastric artery that I'm going to discuss in the following picture. So here is continuation of the internal thoracic artery, which is arising from the subclavian artery. As we mentioned, during its pathway, it gives the all anterior intercostal artery, and also it gives the pericardiacophrenic artery. Also, at the thoracic region, also it gives some mediastinal artery. The mediastinal branches for blood supply of the thymus is like a thymic artery, for blood supply of the bronchus like a bronchial artery, and blood supply of the sternum like external branches. Those are the mediastinal branches. And then at the level of the 6th costal cartilage, then it gives another branches. There are two terminal branches. One is which is passing around the margin of the diaphragm, and it's continue from the sternum is going laterally. It's called musculophrenic artery. Musculophrenic artery is the artery, is one of the end branch of the internal thoracic artery. As I mentioned, it goes from the sternum laterally, and it's giving the last 5 anterior intercostal arteries. So it means that the upper 6 intercostal or upper 6 or 7 intercostal anterior intercostal artery, they are arising directly from the internal thoracic artery, and the last fifth intercostal artery, it's arising from the musculophrenic artery, which is branches of the internal thoracic or end branch of the internal thoracic artery. And finally, the second end branch of the internal thoracic artery is this artery, which is called the superior epigastric artery, and it's entering to the posterior surface of this muscle, which is called rectus abdominis muscle. It is entering to the vagina or rectal vagina of this muscle at the posterior surface, and it's anastomosing with the inferior epigastric artery, which is also passing through the posterior surface of the rectus abdominis muscles of the abdomen, which is arising from the external iliac artery, and they are anastomosing behind the rectus abdominis, the superior epigastric artery, which is branch of the internal thoracic, and the inferior epigastric artery, which is branch of the external iliac artery. And the last important information, the internal thoracic artery is piercing the diaphragm at the region which is called the sternocostal triangle in front of the fiber of the transverse thoracis muscle in this region, and then is giving these branches, the musculophrenic and the superior epigastric artery, that are the end branches of the internal thoracic artery. Concerning the blood supply of the thorax, the thoracic wall, in addition of the thoracic aorta and the subclavian branches of some branches of the subclavian artery, the axillary artery also, it's supplying some part of the thoracic wall. As you see here, the axillary artery is the continuation of the subclavian artery at the external surface of the first rib. The name is changing to from the subclavian artery is changing to the axillary artery. This axillary artery to the thoracic wall, it gives these branches that is considered as a blood supply of the source of the blood supply of the thoracic wall. First branch is the superior thoracic artery. Superior thoracic artery, according to its name, it's supplying the upper part of the thoracic wall. Then we have the thoracoacromial artery. Thoracoacromial artery is the artery which is divided into the acromial branch, deltoid branch, and pectoral branch. So the pectoral branch, according to its name, it's supplying the pectoralis region and the pectoralis muscle. Next artery is the lateral thoracic artery, that it's supplying according to its name, it's supplying the lateral wall of the thorax, and also it giving the external mammarian artery for in the female for the blood supply of the breast. It's the branch of the lateral thoracic. And finally, it's the subscapular muscle, the artery, which is going downward, and it giving the thoracoldorsalis artery. And this thoracoldorsalis artery is responsible for its continuation of the subscapularis muscle, subscapularis artery, and it's giving the thoracoldorsalis artery or thoracodorsal artery, which is supplying the latissimus dorsi muscle. So those arteries that they are branches of the axillary artery, they are supplying the thoracic wall, and in this case we are completing the artery blood supply of the thorax. Regarding the veins of the thorax, the veins of the thorax, we already discussed about the superior vena cava, we discussed about the brachiocephalic vein, and which is formed by the junction of the subclavian vein and internal jugular vein at the place which is called venous angle, the right and left venous angle, that the lymphatic system, they are draining to these angles. In addition of the superior vena cava that is drained to the right atrium and carrying the deoxygenated blood, we have another venous system that in the thoracic region, which is called azygous system. Azygos is a Greek word which means single. It means that it doesn't have a company. What is azygos vein? Azygos vein is formed by the confluence of two main veins. From the lumbar region, there is one vein which is interconnecting the paired lumbar veins that they are draining to the inferior vena cava, and it's called ascending lumbar vein in the right side. The right ascending lumbar vein, which is interconnecting the four paired lumbar veins that they are draining to the inferior vena cava, here is ascending in the lumbar region. That's why they call it ascending lumbar vein. This ascending lumbar vein in the right side is joined with the subcostal vein. This is the 12th ribs, and the same as artery that the last artery, intercostal artery, is not called intercostal, it's called subcostal. So here is called the subcostal vein. So the confluence of the right ascending lumbar and right subcostal vein, they are forming the azygos vein. Azygos vein, when it forms, it's piercing the diaphragm at the right crus of the diaphragm, and it enters to the thoracic cavity at the posterior mediastinum. So at the posterior mediastinum, it's going cranially and till the level of the T4, which is very important level at the, for example, the level of the superior and inferior mediastinum, or the level of the sternal angle. So it's making an arch shape and it's draining to the superior vena cava. This arch of the azygos vein above the hilus of the right lung at the mediastinal surface is making an impression as an impression of the arch of azygos, and also in the right lung we have the impression of the azygos vein. So this is the important pathway of the azygos vein, which is finally draining to the superior vena cava and is one of the tributary of the superior vena cava. So in this case, the azygos vein in the right side, is taking, and the function is the carrying the blood from the 8 till 10 caudal intercostal space, is carrying the blood from the organ of the posterior mediastinum, is carrying the blood, and it's a part of the nutritive circulation of the lung. And also it's the drainage of the external vertebral plexus at the thoracic region. It's draining to the azygos and hemiazygos vein. So this is the azygos vein, which is located on the right side in the posterior mediastinum, and is draining to the superior vena cava, and we said that is formed by the confluence and junction of the ascending lumbar and subcostal vein on the right side. The mirror image of the azygos vein is the hemiazygos vein. The hemiazygos vein, it's the same. The formation of the hemiazygos is in the left side. So it means that it's formed by the main tributaries of the hemiazygos vein. It's by the junction of the left ascending lumbar vein and the left subcostal vein that they are fusing together, piercing the diaphragm as a left through the left crus of the diaphragm, and is entered to the thoracic cavity at the posterior mediastinum, and it's going upward till is variable till the level of T8. Usually is saying at the level of T7 till T9, so it's variation. So in this case, then the hemiazygos vein, it's turning obliquely and it's draining to the azygos vein, and in this case the blood, it continues and is carrying to the superior vena cava. And as you see, the azygos vein and the hemiazygos vein. The cranial segment of the left side, at the left side, it's called the accessory hemiazygos vein. The accessory hemiazygos vein, it's the superior part of the cranial part or cranial segment, which is the mirror image of the cranial segment of the azygos vein. Here we have the cranial part above the level of the T8 or T7 or T9. It's the accessory hemiazygos vein, and all this hemiazygos vein and the azygos and hemiazygos vein and accessory hemiazygos vein, together with the azygos vein, they are receiving the blood from the posterior intercostal spaces. So posterior intercostal veins, they are draining to on the right side, they are draining to the azygos, and on the left side, the lower segment, they are draining to the hemiazygos, and the upper segment, they are draining to the accessory hemiazygos. Those are the posterior intercostal veins that we mentioned. They are going to the between the innermost and internal intercostal muscles as a consequence of the VAN. Superior is vein, then is artery, and then is nerve. So this is the intercostal spaces and the drainage of the intercostal spaces. So what is important is that the first four, and also is variable. So the first four intercostal space, or it's the posterior intercostal veins, they are draining to the either the superior vena cava directly, or they are draining to the azygos vein, and then it's draining to the superior vena cava. But in the left side, the superior four, or the second, third, and fourth intercostal space, they are usually either they are draining to the accessory hemiazygos vein, or they are draining to the left brachiocephalic vein. Also, you can find it in some literature. So those are the difference between the right and left side. So in the right side, the second, third, and fourth, they are either draining to the azygos vein, as you see here, or they are draining to the superior vena cava. The second, third, and fourth in the left side, either they are draining the posterior intercostal vein, they are draining to the accessory hemiazygos, or they are directly to the left brachiocephalic vein. Then it's remaining the first intercostal space. The first intercostal space, in the posterior intercostal vein, they are in the right side, it's draining to the right brachiocephalic vein, and in the left side, it's draining to the left brachiocephalic vein. So the accessory hemiazygos, either it's draining to the hemiazygos, and then from the hemiazygos is draining to the azygos, and then to the superior vena cava. Also, there is variation that is making a H-shaped structure that is draining to directly to the azygos vein, and then to the superior vena cava. So those are the main tributaries of the azygos and hemiazygos accessory hemiazygos, which are the posterior intercostal spaces and posterior intercostal veins. And in addition of that, we have the veins from the viscera or organs. It means that the esophageal veins, they are draining. The bronchial veins, they are draining. Usually there are 2-3 veins as a nutritive circulation of the lung. And also the veins of the posterior mediastinum, like a mediastinal vein, like a posterior part of the pericardium, like a superior phrenic, which is the parietal to the azygos vein. The superior intercostal veins, as we said, the superior intercostal veins, they are draining in the right side either directly to the superior vena cava or it's draining to the azygos in the left side, either to the left brachiocephalic vein or to the hemiazygos accessorius. And also the suprema or the highest intercostal vein, they are supplied by the first posterior intercostal vein that they are going and they are draining to the brachiocephalic veins. So what is important about the azygos system? The azygos vein, hemiazygos, accessory hemiazygos, they don't have valves. And in this case, they are playing role for the terminology of the cavo-caval anastomosis. It's the junction between the superior and inferior vena cava. That when we are discussing about the inferior vena cava, I will tell you about the three important places of the cavo-caval anastomosis. It means connection between the inferior vena cava and superior vena cava. So that's all about the veins of the thorax and the azygos.